This week on the clinic, Christina showed us really the face of pain of herniated cervical discs and the voice of fear in how those discs are going to limit your life, whether you can continue to be, in her case, a nurse, or in your case, whatever you do. I'm going to assume if you're watching this video that you have neck pain, and you may or may not know more about exactly what's wrong. But let's start there with you, with your neck pain. The vast majority of patients, neck pain is caused by one of two different things. It's either being caused by a joint in the neck, one of the facet joints of the neck, or it's being caused by a herniated disc and pressure on a nerve root. If you follow this channel or you've seen our other presentations, you know that a herniated disc can put pressure on a nerve root or inflame it and cause a radiating pain. So how do you know which one? That's what we're going to figure out by the end of this video. Before we get started with the video, I do need to make a disclaimer, and that is, I'm a neurosurgeon, but I'm not your neurosurgeon. And to be honest, I'm not anybody's neurosurgeon. I had to retire due to essential tremor, too shaky to operate, but I still have the knowledge and I can still help you figure out whether your pain is coming from a joint in your neck or whether it's due to a herniated cervical disc and cervical radiculopathy. Please subscribe to our channel. If you want to live free without spine and joint pain, hit subscribe. We'd love to give you more content like this, and if you hit notify, we can give you an alert when we have new content that could be helpful to you. All right, let's get back to you. Let's figure out whether or not your pain is coming from a joint in your neck or whether your pain could be a cervical radiculopathy due to a disc herniation. Before we answer that specific question, there's two things I need you to know. There's two facts that you have to understand to be able to answer my questions to figure out what's wrong with you. The first fact has to do with the pattern of pain. Cervical joint pain, pain coming from a joint in the neck, feels like an ache in your neck and radiates into your shoulder. In this figure shows typical locations of radiation of joint pain in the neck depending on the level at which it originated. For example, the red. The location of pain for the C4-5 vertebral body, the joint between the C4 and the C5, is the area of the red. The brown is the C5-6 down here. So the point is, just because the pain is coming down into the top of the shoulder doesn't mean it's a nerve root pain. It could mean it's coming from the C5-6 joint. However, joint pain is typically a soreness. It's not electrical in nature. It's an ache. That ache shoots down, but the vast majority of the ache is actually in the neck itself. The second thing I need to explain is exactly what is a cervical disc herniation. This, in the drawing here, is the hard outer part called the annulus. And you can see how the annulus is made out of these layer after layer after layer. It's like Gore-Tex. It's made out of this really strong stuff. Despite the fact that it's so strong, it can tear. And if you get a tear in the annulus, then this soft inner part, this is called the nucleus can herniate through the tear in the annulus. Now, it just so happens, of course, this tear could have happened anywhere in the annulus, right? It could have been here, which would take it into the belly and the lumbar spine or in the neck. It could have been out here to the side, but it's almost always right at this position. And we don't know why, but it just seems like that's where, for whatever reason, the annulus has a weak spot. So the tears are mostly right there. And that just happens to be right where a nerve root emerges from the spinal canal. So this is the normal side. Here's where the nerve root emerges from the spinal canal. But on this side where there's the tear in the annulus, the nucleus pushes out and it pins that nerve root. Now that does two things. First, you can see that there's compression. The annulus is torn and the nucleus can compress the nerve root. And you'd think that would be the main cause of nerve root pain, but oddly, it isn't. It is a cause and it's a contributor, but it's usually not the main cause. The main cause is this inflammation that builds up around this herniated nucleus, and that nerve root just happens to be there. But this inflammation is intense. Why does the body do that? Why does it get so inflamed? Well, this nucleus that herniated through the tear in the annulus, it has no blood supply. And your body knows what's you and what's not you based on the blood supply. So when this happens to your body thinks there's a foreign thing, there's a nail sticking in me. Have you ever seen what happens when you leave a splinter in your bottom of your foot and don't take out the foreign body right away? It pusses out. Your body figures out very quickly that's not you. Everything turns red and inflamed. And if the nerve root's running right through that red and inflamed war zone, then you get a radiculopathy, a disorder of the nerve root. A disorder of the nerve root means everything the nerve root does, it's not able to do right. And what do nerve roots do? Well, four things. First, motor. So if you get a disorder of a nerve root, a radiculopathy, you might have weakness in the muscles that this nerve root goes to. What else does it do? Number two, sensory. If you get a disorder, an inflammation of this nerve root, you might have numbness in all the areas and patches of skin that this nerve root is sensory for. What's the third thing? Reflexes. If this nerve root is involved in the reflex and your doctor taps the reflex, when that electrical impulse comes down through here, it can barely get through, it's so inflamed. So it disrupts the reflex. And then the last thing, of course, is pain. There's going to be pain, and the pain's going to feel like it's in the muscles that are innervated by this nerve root. So radiculopathy, inflammation causing dysfunction of a nerve root, is a disorder of motor, sensory, reflex, and pain as it relates to the root, and it's commonly caused by a nucleus that's herniated through a tear in the annulus. Go get something to write with and some paper. I want you to write down your responses to 4 questions. And based on your responses to those 4 questions, we're going to know the source of your pain. Question number 1. What does the pain in your arm feel like? Just ignore the pain in your neck. The pain in your arm or shoulder, is that more electrical? Does it feel like electricity that shoots out of your neck and into the top of your shoulder? That's your C5, or your bicep. That's your C5. Does it zing all the way and just ache in your forearm? The muscle called the brachioradialis, that's your C6. Does the pain shoot like electricity down into your thumb and your index finger? That's also C6. Or is it these 2 fingers? I'll try not to be obscene. These 2 fingers are your C7. Or is it shooting like electricity out here to the edge of your pinky, your little finger? Because that is C8. So depending on whether the pain is shooting down into one of those areas, if that's your type of pain, I want you to write 1, period, root. And if it's here, I want you to write a 5. If it's here, 5. If it's here or here, 6. If it's these 2, 7. And if it's here, 8. Or is your pain 80, 85, 90, 95% in the neck, and then kind of shoots maybe down into the shoulder? Not like electricity, but it's just kind of feels like where it goes down into the shoulder, maybe as far out as the top of the deltoid, the top of the shoulder, but not much farther than that, or not any farther than that. If that's the kind of pain you have, mostly in your neck, going to the base of your neck and your shoulder, then I want you to write down facet. Facet, F-A-C-E-T. And remember that chart that I showed you earlier? Based on the pattern of where it's going, I want you to put a number by that. The number is going to be a 5, 6, 7, or once in a long while, an 8. Second of 4 questions. Second question for you, and only you can answer this. It really helps answer this question if you have somebody, a partner who can help you. But if you don't, you can kind of do it yourself. And the question is, are you numb anywhere in your arm or hand? Are you numb anywhere in your arm or hand? And the reason I say it really helps to have a partner is a lot of people just don't even realize it. They're numb, but they didn't realize it. So the best way to find out is to get someone to help you and have that person take both the tip of their finger as well as the tip of a safety pin or maybe a butter knife, something with a little bit of sharpness to it, but not so sharp that it's going to cut you. And we want them to test you in several places. The first place we want them to touch is the top of your shoulder, the top of your deltoid. Have them touch one side and then the other. Do these feel the same? Have them poke you with the little pin very lightly on one side, then the other. If each of those feels the same, then go on and test the second location, and that's here between the thumb, the pad on your hand, between your thumb and your pointer finger, right there. Have them test you right there and right there. Also there and there. That's, if one of those is numb, write the side and the number 6. The side and the number 6. The third place I want them to test you is on these 2 fingers, the middle finger and the ring finger. Just have them, does that feel the same as that? And if you touch it with a little pin, does that feel the same as that? And then the last place is right along the outside. By the way, if that one of those is numb, put the number 7. Put root and 7. Or if it's the outside, put pinky and 7. Root, pinky, and 7. So are you numb anywhere in those places? The top of the shoulder, the pad between your thumb and your pointer finger, along your middle or your ring finger, or along the outside of the little finger. We're gonna, if you're numb in any of those places, the answer is yes. If you're not numb in any of those places, the answer is no. Third question for you, are you weak anywhere? And again, this is one you can kind of test yourself, but it is a little easier if you have a partner. And we're going to test some very specific muscles. The first one is your chicken wings, your shoulders. Bring your shoulders up like this and have somebody push down on each side. See if they're the same strength. The second one is your biceps. We're going to have them pull. The third one is your brachioradialis. Try to hold their hand like you're shaking it and have them try to turn it over and you resist. Your brachioradialis. The last one, the next one we're going to test is you holding your fingers up toward the sky. And the last one is you straightening your elbow. If you have weakness on one side of your deltoid, your shoulder, or your bicep, I want you to write down yes and the number 5. If you have weakness of that brachioradialis, I want you to write down yes and 6. If you have weakness of bending your fingers backward, yes and 7. And the 8th is actually harder to test, but it's actually the intrinsics in your fingers. If you feel like maybe your grip isn't as good on one side as the other, you can't hold on tight with your fingers, then that's a yes and an 8. So number 3, are you weak anywhere? 5, 6, 7, or 8, just like we did with are you numb anywhere? All right, we're almost there. Fourth and final question. This is the last question I'm going to ask you before we really get down to whether or not the pain is coming from your joint or it's a cervical radiculopathy due to a herniated disc. And that question is, what does your imaging say? Some of the imaging you may have had done, you may have none of this, but if you do, I want you to look at the reports done by the radiologist. Let's start out with an x-ray. If you had an x-ray done, I want you to look for the word arthritis. And if you see any word other than no mention or mild arthritis, then you put root. But if you see the word moderate, severe, marked, or any other kind of arthritis, I want you to put the word facet, because that is joint. That's going to be a joint pain. Second thing to look at is your MRI report. Did you have an MRI? If you did, have a look at it. The radiologist will have dictated about the discs at every level, and they'll also comment on the nerve root at every level. I'm looking for any marked, moderate narrowing, marked compression, severe anything on a nerve root. If there is, I want you to write down root and the level. If it's the 5th nerve root, the radiologist says, or if it's the C5-6 disc, then write root 5/6. Then the last thing, the third type of imaging, is a CT scan. This one is not commonly done anymore, but you might have had one if you went to an emergency room at some point. But you should look at the CT scan report the same way you would the MRI report. We're looking for any moderate, marked, or severe neural foraminal narrowing, disc herniation, large disc herniation, nerve root compression, any words like that. I want you to write the word root and the nerve root or the level from the report that they're talking about, whether it's the C5, 6, 7, 8, or the 5/6, 6/7, etc. All right, drum roll, please. We're there. Let's take her home. Let's land this thing. Look now at all of your answers. If everything you wrote says joint, your pain's coming from one of the joints in the neck. If everything you wrote says root, and you see the same level, 5, 6, 6, 6, you see the same number all the time, then it's most likely a nerve root, the 6th nerve root, herniated disc, C5-6 level. And then, of course, everybody is likely to be somewhere in between. If it's right in the middle, you don't know. And if you don't know and you can't figure it out, that's complicated. That's not dangerous, but it could just be complicated. You need to call us at Phoenix Spine and Joint. Have one of our operators work with you and figure out what's going on. Take the history and help you with the review. But if you're on one of those extremes, you should be able to answer now whether your pain is coming from your joint or a herniated disc and your nerve root. Why does it matter? Well, it matters for two reasons. The first is the right treatment and the appropriate treatment depends on what's wrong. I mean, the right solution depends on the problem, right? If your problem is coming from an arthritic joint, if you have neck pain, even if it's radiating out into the shoulder, but it's coming from a joint, then the treatment for that is going to be radiofrequency ablation. And please check out our website on medial branch block and radiofrequency ablation. Very effective treatment for cervical neck pain due to arthritic pain in the neck. On the other hand, if your problem is a herniated cervical disc, you're much more like Christina in our episode of the clinic today. You're looking at ACDF surgery, or less commonly, microdiscectomy surgery from the back of the neck. Again, head over to our website and you can learn more about those treatments on the pages over there. Well, you made it to the end. Congratulations. I hope this was helpful. Again, we know this is complicated and we know you are in pain. If you are struggling with neck pain and you weren't able to get a good sense of it from this episode, then you need to either reach out to Phoenix Spine and Joint or a doctor near you. If it's a doctor near you, you've got 3 choices. And I hope this video made clear what the right choice would be. If you think it's a facet joint and you're in good health, then you could reach out, but you're not sure, you could reach out to a chiropractor. If you think it's a herniated disc and you've got problems with your health, diabetes, heart disease, high blood pressure, any other comorbidity, then you should reach out to a primary care physician and let them organize and supervise your care. If you're sure, root, it's a herniated disc and you've tried for 12 weeks to get better on your own, but you just aren't making it, and you're still having significant pain, then you should see a spinal surgeon, and that should be either a neurosurgeon or an orthopedic surgeon who's done a fellowship training in doing surgery on the spine. Thanks. If you have any comments, put them in the link below. We'd love it if you'd subscribe. If you want to get more content like this, please hit subscribe and enable notifications.